So I think what's really important is to understand that these feelings are entirely normal. The situation with regard to COVID is the abnormal, but the feelings of anxiety and fear are normal, appropriate responses with regard to how we manage stress. So stress is our body's evolutionary response with regard to how we deal with change in our environment in an adaptive, helpful way. So it helps us to be able to respond to the environment, to be able to think quicker, to be able to speed up our bodies, to get oxygen flowing into our lungs, to get our heart beating faster, so we can get ready to fight or run away or deal with the danger in an effective way. So it's important to be aware that these are normal, common feelings in the population at the moment. The first phase of the COVID-19 psychological survey in Ireland has shown that 20% of people have significant anxiety. Almost a quarter of all people are feeling low in mood or depressed. And in fact, 40% of people are feeling very lonely at the moment. So the question is, how do we respond in a helpful, healthy way to deal with these challenges? And there are lots of things we can do to help ourselves. And in fact, I would commend Aoife Smith from the IKA on her website, the IKA website that you're on at the moment, which outlines a whole host of information that's very helpful and available through the HSE and other services. But to summarise that advice, the first thing is the importance of having a daily routine, a structure each day. At a time like this, we can tend to lose our structure, our sleep and wake cycles, because each day blends into the next. But it's important to have a plan for each day, an aim for each day, doing things that are pleasurable and of interest to us, as well as the routine tasks of day-to-day life. It's important that we maintain our sleep cycles, eat well and healthily, and maintain a degree of physical fitness. And I would encourage everybody to get outside their front door every day for at least a couple of minutes every day. Other things that are important relate to how we speak to each other people, how we stay connected, especially at a time where we're maybe less able to have direct contact with relatives and friends. So having daily contact either by phone or by emails, but also the importance of talking to people about how we're feeling rather than keeping that hidden. Human beings need to share and put words on their feelings in order to be able to process them effectively. Another good way of doing that, for example, is to write down how you're feeling and to be able to reflect on that. And all of these are good strategies for helping us to stay on top of how we're feeling and how to reframe our experiences in a more helpful way in terms of processes such as cocooning and keeping safe and reflective time, rather than considering it in terms of phrases such as being imprisoned or isolated. Additionally, there are other strategies we can use around mindfulness and relaxation strategies, and there are some very good websites with relation to that. One I could recommend is the beaumont.ie/MARC. That's the Mindfulness and Relaxation Centre website. And I'll ask Aoife to put this up on the IKA website so that people can access it. It's a free site that you can link into and learn and be taught about how to do straightforward mindfulness, breathing, relaxation strategies to help you to deal with symptoms of anxiety and stress. Something I would emphasise is the importance of recognising that rather than separating our health into physical and mental health, that all of these aspects of our health are important. Mental health and psychiatric disorders relate to disorders affecting the brain as the main organ, as opposed to renal disease affecting the kidney as the main organ. But one of the aspects in relation to that is not just the brain as a static unit, but how it relates to the environment and adapts to what's happening inside of our body as well as outside of our body. So considering that psychiatric disorders such as anxiety and depression, which are very common in the general population, which are elevated in patients with chronic health problems, and for example on patients on dialysis, about a third of all patients at some point will have an anxiety or depressive disorder. So in the same way as you would have appropriate treatment for high blood pressure or diabetes as part of your kidney journey, similarly, you should have appropriate treatment for your anxiety or your depression. We have good evidence-based treatments now that are well tolerated, both talking treatments and medications, and the importance of being able to get this good care will improve your overall health journey, including your renal journey as well as your overall quality of life. So what I would encourage for people who have psychiatric disorders is, first of all, to be confident about asking for help with them from your healthcare giver, from your GP, from your renal doctor, from your team. The second thing is, if you're already on treatment or on medication, make sure that you're linked in with your service provider. Most services are providing at least virtual clinics or phone appointments and support. Make sure that you have your medication up to date and available for you in the pharmacy, and then engaging in all the other self-care strategies that we've previously discussed. These are very, very understandable and appropriate concerns for patients who have kidney disease and are very concerned about the pathway ahead and the personal impact of COVID in terms of risks of developing COVID, but also in terms of deferring the opportunities for transplantation. These decisions are only made in terms of weighing up the person's best chances, because when you've had a transplant, for example, the worst thing would be to be in a situation where you're more vulnerable to COVID, especially at a time where your immune system is going to be suppressed. So what's important is that the transplant program will be up and running as soon as possible. And we are hoping that that will be started in a stepped way from the end of this month, from the end of May. And so moving forward from there, initially with patients who have good general health, who are fit for transplantation, before moving on to patients who are at higher risk, and then finally onto live donor program transplants from there, because you're then in a situation where you have two people involved in terms of the transplant journey. So there is a clear pathway. I think what's important to be aware of is the changing environment with regard to the healthcare service. So our initial levels of anxiety in response to COVID and the threat and the certainty of the lockdown are now moving on to a new area of anxiety and worry where things are less clear. How long will it take? How safe will it be before we can reinstigate the full programs as we've had them before? So these are all areas that are being negotiated, focusing on the patient's best interest and safety, so that when you get your transplant, your outcome is as good as it can be, and that you have that transplant for many, many years to come. Carers are under tremendous amounts of stress at the moment for a whole range of reasons. The general uncertainty with regard to COVID, caring for vulnerable people at home, and concerns with regard to the risk of transmitting the COVID to the person, the increased physical demands on the carer of having to be the one to go out and interface with the world, do the shopping and all of these other aspects while their loved one is in quarantine or social isolation. So in addition to that, then fears, financial worries, worries about employment, all of these things have an added burden of stress for carers. In that context, it's important to be open and supportive of your carer, to recognise if they're feeling a bit snappy or irritable, rather than reacting to that, perhaps to say, you must be under a lot of pressure, or I really appreciate all you're trying to do at the moment. So those small tokens of appreciation, being compassionate, not jumping into arguments perhaps, giving them a little bit of space, and then encouraging them to join you in the self-care strategies around daily routine, pleasurable activities, going out, sitting in the fresh air, maintaining physical activity, all of these being part of day-to-day ways of optimizing how we all work as an enclosed unit together. But also knowing that these are valuable times where we can spend positive time together and enjoying that component as well. Understanding that our mental health is a part of our overall health journey, just as important as dealing with our kidneys, just as important as dealing with our blood pressure and our diabetes, etc. And using the resources that are available out there that helps us, as I say, that are available on the IKA website, available through the HSE, the support that's now available with regard to community care supports, on post, coming in to check in on people, all of that social connectedness that's out there to support the most vulnerable people in our society. And within that then, knowing that this time will pass and knowing that we will move forward, and as a society, how well we are caring for each other at this time.